Thank you, Victoria. I think that was extremely helpful. I will allow one or two questions of factual clarification at this point. No speeches, but if somebody didn't understand something, Mr. Kuhnrod?
Mics, no mics?
Yeah, it's there.
Thank you.
It's on.
Okay. The question is the educational component. Can you just say a little bit more? How much education per woman farmer to understand the nutritional impact goes into this approach?
Sure. Oh, good. This one works too. This is an area that we're working on right now, so I can't produce any actually empirical data. But based on the model, we're retooling it to incorporate some behavior change to help the workers, the health workers from the local facilities, better be able to counsel and negotiate with mothers to adopt some optimal breastfeeding practices, optimal complementary feeding practices. And we know from other programs outside Helen Keller International that you can get some major impacts on these indicators pretty quickly if the behavior change investment is made right from the start. We should be able to speak to this more clearly given some more time when we can monitor and evaluate particularly our ongoing program now that's taking place in Nepal, where this has been a major emphasis. So watch that space.
Okay. Back there and then here, just up. I'm just going to allow two because otherwise we'll run out of time.
Just one quick question. This would, what was the typical size of the home garden that people cultivated? And would this have excluded the really poor who don't have any land at all from these programs?
Okay, and then let me take that question, second row there. Mm-hmm.
Ma'am, do you visualize a situation that everyone at the farm level, everyone at the household level should be educated? And if that education is to be imparted in terms of nutritional education, a lot of funding arrangements shall have to be done with reference to a large country like India also. So how would you visualize this situation and cope with?
Excuse me, I couldn't understand that. How would you what? Your last question.
Pardon? So what will be the funding arrangement for such a education? The funding arrangement for nutritional education.
Okay. So, quick question here on how big were the homestead gardens and was access to land an issue? And then the second question with regard to funding.
Yeah, these are, I can't give you the exact land holding sizes. I do have a colleague in the audience who could do that, but certainly these are families with small holdings. And in some parts of Bangladesh in our program, we've actually been able to bring in landless individuals, some of the women to vaccinate some of the poultry to try and involve them in the activities. But this is another challenge as landholding gets smaller or as we get closer to urban areas, how to actually deal with that. In terms of funding for the nutrition education component, that's part and parcel of the overall funding for the program. One would hope that the capacity of the local health services would be maintained over time, so that's sustainable as well. But certainly I think there's more investment that could be made at pre-service training level throughout a number of these countries as well to attack that same issue.
Okay. We'll have to postpone the rest of them for the discussion period, otherwise we'll get stuck on this particular case study. Thank you so much, Victoria. Very helpful. With that, let me turn to Milton Filho from Brazil and talking about the international actions against hunger.
Thank you very much. First of all, I'd like to say that what I'm going to do is try to put the school feeding program in the context of public policies for development. I'm a diplomat, and as you probably heard yesterday, the president of the school feeding program of Brazil is here. Daniel made a very good presentation yesterday. So I think that you don't need me to repeat the things about the Brazilian school feeding program, but perhaps how we inserted it in our public policies of local development. Well, first of all, agriculture is the main, as you know, is the main economic activity in developing countries. And as you know, 3/4 of poor people are in rural areas in the developing world. Consequently, in order to obtain socio-economic development, there is need of sustainable bottom-up agricultural improvement. what we found as a solution in Brazil to build bottom-up public policies was a council. It's the National Council on Food Security, which is the only council that directly sends its conclusions to the president. It's in the presidency of the Republic. It has 19 representatives of ministries, the ministers themselves or their substitutes, and 36 representatives of civil society. I say that because it's not possible to establish a program like ours without a broad base. No, I mean, I'll give you an example. Last year, we approved a law by which 30% of all the food bought for the school feeding program has to be bought from household agriculture. It's very difficult for a ministry or two ministries to pass that kind of law. So the council has a fundamental position in a broad public policy for school feeding. To do so, agriculture must be based on the right to food, fundamental and universal. The right to food states that countries must protect, promote, and provide food for every citizen in need. That was fundamental for us. You know, some international organizations used to say that we should focus, that we should provide food only for poor children. And we said, no, that's not eating. No, eating is communion. No, swallowing things is one thing. No, eating is another thing. No, I mean, in many religions, no, we eat God. No, so that's and well, we are in India, the country of Gandhi, that said for poor people, God is bread. No, I mean, so it's fundamental to have that rights-based approach. The poor children eat, and the rich children eat too, and that was very interesting for us. Also, to talk to the society, saying, well, we are one of the big agricultural producers. We have international obligations. Today, we are the 7th economy of the world. And I stress that because yesterday some people were a bit scared when Daniel said that our program has a budget of 2 billion per year. But I mean, as I say, today we are the 7th economy of the world. We are 190 million people. So I mean, it's understandable. And this program covers 1/4 of the Brazilian population, almost. I mean, it's 48 million children, 48 million meals per day. The rights-based approach allows to find a broad base of consensus for food security policies, as I said, and it also allows us to have an international policy that not only is an extension of our internal policy, but really is allowing us to, with other countries, to protect, to promote, and to provide food when it's necessary in other countries. In that sense, agriculture has to be seen as a chain, or even better, a net, that starts with supply and goes back to production. This point, I think, is very important. Brazil has always been a good producer of food, but we had hungry people, a lot of hungry people in Brazil. In fact, it's only now that most of the Brazilian people are middle class. It's during the 8 years of President Lula that we could take from poverty 30 million people. So the problem was clearly not a problem of production. It was a problem of access, like it's in the most of the world. No? We have production for everybody to eat, in fact, today. No? But we have 1 billion people almost starving because they don't have access. So the question of access is fundamental. So what we did was to decide that we should intervene in the commercialization phases. No, I mean, give the household production or smallholder producers the opportunity to commercialize their production. No, that's fundamental. I give you an example. Because we passed this law last year, one settlement of land reform that I visited last year, this year they are selling all their production to Mary's, no, for school feeding programs and also for we call popular restaurants, by which you eat by 50 cents a meal. So street people, elderly people that could not eat can have access to very high quality food because we are talking about organics. It's interesting to say that this law gives privilege for producers that come from settlements of land reform, from Maroons settlements, and from indigenous production. No, I think that's very important too, because the state has to treat differently different people and different contexts. In order to build such a net, we need to look simultaneously at providing food and at the roots of food insecurity, such as access to land and water in the national contexts. I have to say that Brazil was one of the countries with the biggest concentration of land, and we still have, even if land reform has much progressed in Brazil, we still have a huge concentration of land, and that's why we give priority in buying to settlements of land reform. There is need also to look at the structure of commercialization, stocking, existence of public structures, credit for producers, crop insurance, and access to agricultural knowledge. As you well know, commercialization is very much concentrated today. To give you an example, for retail in Brazil, we have only 3 big companies. 3 have 50% of the retail market. That gives you the greatness of the challenge. Public stocking is fundamental too. As you know, some international organizations in the 90s defended that we should not have public stocking, that we could, you could just take the phone and ask for the food you wanted. And we realized that during the energetic crisis we had in 2008, it was not really like that. Some countries could not, some African countries, for instance, that used to import rice from Asia could not do so because of the prices of the freights. So it's very important, yes, to keep public stocking, and that was one of the causes why Brazil had only 25% of increase in food prices during the food crisis in 2008, because we had public stockings. And also the fact that you allow household agriculture to keep their stockings to sell at the best moment. Otherwise, you have to sell when you harvest it, and you sell it at the lowest price, obviously, because that's the law of the market. The biggest offer, the lowest the price. So it's very important to keep
1 minute.
Oh, well, yes, 1 minute. Okay, let's rush. I won't talk about credit for producers, crop insurance that somebody touched just now. It's fundamental too. In fact, commercialization represents the decisive factor that allows people to have or have not access to food. In that sense, adequate public policies are fundamental to permit people to have access to food and to allow producers to have market for their production. Programs such universal school feeding can guarantee access to food for almost a quarter of a country population, which is the case of Brazil. We can do that because we are doing that, with a very reduced investment, creating a virtuous circle of better nutrition for students, better capacity of learning, income for their parents, and the socio-economic development of the whole community. It's seeing the children not isolated, but in the context of their family and their community, because otherwise their food security is just short-term food security, and they will finish in a shantytown. In that way, children's food security will be considered in the context of their family's food security and their community's food security, as I said. In fact, agricultural development, as every other development, has to be sustainable, socially, inclusive, economically, democratically, and environmentally respectful. Thank you very much.
Thank you, Milton. A lot of ideas were included in that, and I think sort of while you started out talking about school feeding, in fact, you brought in a much broader context of agricultural development, commercialization, reaching out, the right to food, inclusiveness in the population's access. Very, very useful. Thank you. I'm going to turn to, since in fact time always slips away, I'm going to turn next to Tom Arnold, the CEO of Concern International. Huh? Worldwide. Oh, Concern Worldwide, sorry. Concern Worldwide, not Concern International. Concern Worldwide, to talk about the program that they are doing in Zambia called RAIN, Realigning Agriculture to Integrate Nutrition. I think you'll hear some echoes of the presentation from Victoria that will be very helpful. Thank you.
Okay, thanks, Emmy. Just so we get it straight from the beginning, Concern Worldwide, yes. And just a little bit about us. We're a non-governmental organisation headquartered in Ireland. We have Concern UK and Concern US as well as part of the family. We work in 25 countries, mainly in Africa and some in Asia and also in Haiti. We have a strategic linkage with IFPRI for the last number of years, which we value a great deal. And I have two colleagues here in the audience. One is Anne-Marie Meyer, who's in nutrition advisor in the London office, and the other is Rahul Rawat, who for the past 3 years has been working actually in IFPRI itself, but working on operations research for Concern, and certainly some of the more detailed aspects of this program, they know more about it than I do. Just to put another piece of context, obviously the issue, people talk about 1 billion hungry people in the world. When you break that down, we're talking about severe malnutrition, which accounts for less than 10% of that number, and chronic malnutrition, which accounts for the rest. So chronic malnutrition, with all its manifest costs in terms of human development, etc., is really the big problem. Now, Concern has been very involved in nutrition issues very much for the last 10 years, and we're central to developing the approach which is now called CMAM, Community Management of Acute Malnutrition. And just a little background on that, because it's relevant, I think, to what I'm going to talk about in more detail, RAIN. The original idea as to how to tackle severe acute malnutrition came from Steve Collins, of Valid International. And he came to Concern in about 1990, around 2000, around that time, to say, could we test this together? And over a period of 3 years, we began to field test this approach. I mean, most of you, I take it, are relatively familiar with CMAM, to test this approach in a number of countries, which we did. And we accumulated evidence relatively quickly that this was a more efficient way of tackling severe acute malnutrition than what was then the conventional way, dominantly based on therapeutic feeding centres. We showed that death rates were reduced and coverage of population was significantly increased. And we brought that information to an important meeting which was held in October 2003 in Dublin, which the wider nutrition community attended. And as this if you like, technique, we were calling it then community therapeutic care, was taken up by more agencies, more evidence accumulated. And that ultimately it led in April 2007 to the adoption by the main UN agencies of community management of community management of acute malnutrition as, if you like, the preferred way to deal with this problem. And now I think the challenge is to implement it and integrate it into health systems in many countries, and that's still a huge challenge ahead. But that still left the chronic malnutrition, the 90% of the hunger problem dealing with chronic malnutrition. And in discussions with IFPRI, which took place in September 2009, we came together and began to ask, could we design a program which would directly address this issue, based obviously on what the knowledge that was there about what was known about how to deal with this problem, and the knowledge that you really did need an integrated approach, bringing together agriculture, health, and nutrition interventions. And arising out of that meeting, there was an agreement that we would attempt to design a programme which would address this directly. We got funding from Irish Aid to support the programme design. And so during 2010, basically, we've been working on a programme design for this problem. And this is what we now call the RAIN programme, the Realigning Agriculture to Improve Nutrition. We also did, within our organisation, we went to tested it, well, as we were working through and working out this design, we tested it went to 3 different countries to see which country we would actually implement it in Ethiopia, in Uganda, and Zambia. And we eventually came down on the side of Zambia, and that's where it is now about to be commenced in Zambia. It's going to happen in the district in the central region, Mumbwa, which is an area which currently has 59% childhood stunting. And the core objective of this programme is to develop a sustainable implementation model that combines agriculture, nutrition and health interventions to effectively prevent child stunting and maternal undernutrition among poor rural communities. So that's, if you like, the broad objective. And more specifically, the objective is to reduce the prevalence of chronic malnutrition among young children and improve the nutritional status of pregnant and lactating women through targeted intervention during the critical period from conception to 23 months of age. To realign and integrate activities and mechanisms within the Ministry of Agriculture and Cooperatives and the Ministry of Health, especially at district level, to more effectively and efficiently achieve sustainable nutritional outcomes, and to use and share evidence generated at the district level to influence local, national and international policy agenda to prevent child stunting. So that's, if you like, very much, I think, central to the sort of discussions we've been having here at this meeting. Who's involved in terms of partners? Concern will provide the technical assistance and capacity building and will facilitate the coordination and alignment processes between the key line ministries. And those 2 ministries are the Ministry of Health and Ministry of Agriculture and Cooperatives. There's also a local NGO involved, the Mumbwa Child Development Agency, and another one called Women for Change, who will support the gender-related activities. And IFPRI are very directly involved in all the aspects of monitoring, learning and evaluation which will come from this project. The specific project approach envisages that the project will use the existing evidence base and will improve it where gaps exist through an appropriate project design and ongoing operations research. There'll be an integrated agriculture, nutrition and health and gender interventions adapted locally by communities. It's focused on both government and non-government partners working in an integrated way to ensure sustainability and encourage replication and scale-up. It's targeting mothers and children during this window of opportunity up to 2 years of age for a child to maximize impact and nutritional status. It will place special emphasis on ensuring that extremely poor households will benefit from the project through effectively adapting project services to the needs of the extreme poor, and the empowerment of women will be a cornerstone of the approach and a key outcome of the envisaged system change. Now, somewhat more detailed aspects of the project design, it is looking at this whole issue of intersectoral interventions coordinated by Concern and implemented by the partners overseen by the government ministries. There'll be 2 different sets of project interventions, and the effectiveness, including the cost effectiveness of each set, will be compared to examine the output. And these interventions are agricultural activities only, combined agricultural activities and nutrition and health related activities, and then a control group. The agricultural activities will aim at improving the availability of and access to micronutrient-rich plant and animal source foods at the household level and improving food production techniques. There'll be a nutrition and health component, primarily through a behaviour change communication strategy to optimise food utilisation by improving maternal nutrition, infant and young child feeding, hygiene and healthcare seeking practices, and linkages to routine healthcare services and campaigns. The activities will emphasise gender equality and women's empowerment to support the improvement of women's status and decision making. Other activities will include improving household level food preparation, storage, preservation and preparation techniques, and exploration appropriate time and labour, exploring appropriate time and labour saving technologies. And together, these elements will improve the availability of high quality foods at household level, maternal and child nutrition, infant and young child feeding, hygiene and healthcare seeking practices. And clearly we're going to be using rigorous monitoring and evaluation through all of this. So that in essence is the project. We think it is addressing an absolutely core issue, the core issue of how to directly deal with the issue of stunting, which is such a major problem with such long-term consequences. We're clearly very interested in working closely with government authorities for interests of sustainability. And we'll be very keen, as this project develops, to share any knowledge that emerges from it. We also would like to extend our work, the same approach, to test it in other countries. And that is a matter of funding. And of course, if there are any funders here who would like to help us do that, we would be very happy. And I'd close on that, Emmy.